Welcome back to the program. I'm Chris McCutcheon. You're listening to Aging with Options, Louisville's only radio program dedicated to seniors and topics of importance to our senior community and those who care for our seniors. My guest in the studio is Lynn Harrelson, a senior care pharmacist and owner of Senior Pharmacy Solutions. We've been talking about medication management for seniors. Senior Pharmacy Solutions has been instrumental in helping seniors in the Louisville area use their specific group of medications more wisely through their medication therapy management services, and we're talking to Lynn about that now. And in our last segment, we discussed the prevalence of medication-related issues and problems and the impact, and specifically the financial impact to individuals and to the economy in general. And Lynn, let's get into a little bit more. You specifically have a program that is very innovative, very unique, medication therapy management services. Tell us a little bit about that. How does that work?
I have a service that I've been offering to seniors for a number of years, and it's a service that is offered in the patient's home. It is, regardless of whether the home is their residence, their assisted living facility, or retirement center. Mm-hmm. And I work with them in looking at all of the medications and seeing what we can do to improve it, their use of the medicines, to improve their outcomes, to minimize the problems and maximize the benefits. And the service starts out just like when you go to the doctor, you get a form that you fill out about your history and physical. I send paperwork to my patients and their families, and I ask them to fill out not only a history and physical type of thing, but also some other forms. And then I visit the home with them, and we go over that. And that's what I call my discovery period. I go in and we talk. So if you were my patient, I would sit down and I would look at the medicines that they're on and look at the forms that tells me how they're feeling on their medicines, and we go through an intensive question and answer period. I see a lot of medications a lot of problems during that process, and what I try to do is get my patients to be much more specific as to how they feel and if they feel good, what makes them feel good and what makes them feel bad. And many times in this question and answer period, it's often been called an interrogation session, but it's not. It's meant to have a good feeling back and forth. I am able to discover there's 4 or 5 more medications that just didn't make the list. And that's part of the problem when seniors go to the physician's office. Yes, I have my list. This is everything I have at home.
From the time that they completed the pre-work for you, the information that they provided for you on their own, till the time that you come in the home, you end up finding out that there are actually more medications than they had even indicated.
Yes, it's really remarkable. I will go through and ask them 2 or 3 times, and I'll say, it doesn't make sense. Some of the things just don't make sense. And I said, what do you take for this? Oh, and they'll go to another place. They have stored that medication someplace else. And it's usually 4 to 5 more medications. My first question is this medicine on the list that you've provided your physicians? And it's not. So it's a problem. I see it. It's also a problem when they go to the other healthcare providers. So that's one of the biggest reasons that our problems start is incomplete information with the healthcare providers. So I try to make sure we develop a comprehensive list of the medicines that we use. So we go through their question and answers. Then I come back to see them in probably usually the next week, and we have an action plan developed. And the action plan is what I have thought might be the best things that can be done to minimize the problems that the patient has reported to me, how they feel. If they're feeling a certain way, Is there something about how they're using their medicines or the way they're using their medicines that we can avoid that problem? Then I also look at maybe they're not getting the benefits of some of their medicines. Could it be used in a better way? So the first part of that second meeting is used primarily on how to improve the response and use of their medicines. Maximize the benefit, minimize the problems. Then we look at the things that would need to be addressed with the physician. And all of this is written on paper. It's written in large print, easy to read, bullet points, very, very comprehensive. And we discuss what might need to be done with the physician, and I will work with the physician if they wish. A lot of seniors and or their family, they want to handle or attempt to handle the interaction with the physician, and I applaud that. I think one of the biggest things that will improve the health care of all America if we as consumers in the health care are more engaged in our own personal care. So I discuss different approaches. We talk about it, but I always make myself available should they wish me to follow up on it. So they have an action plan, things that can be addressed to improve the medication use. They get a personalized chart that includes all the things that are specific to them. It's very, very specific to them. And it has the action plan. It has all the information that they need. It has the tools that they need to help them be able to report back to the other healthcare providers how they're feeling.
Now, give me an idea of the time frame that's involved here from the patient, the client filling out the information, you're coming in doing an initial assessment, following back up with a follow-up visit. What's the time frame for the entire process as well as the assessment portion of it as well?
From the time I make an initial contact with a patient or their family, I get the forms out, and then I make my 2 visits. I try to do that in 2 weeks because that's a pretty tight snapshot of what's going on. It keeps things fresh. It keeps things motivated. It keeps things moving. Once we have that second meeting and we're working on an action plan, then I provide what I call coaching to action services for approximately another 2.5 months. So the whole service is a 90-day period. And what the coaching of action is, I will ask them to do certain things like take their medicines in a certain way or to address certain things with a physician if that's what they want to do. If not, I'll do that. But I want to get them to move a certain way so their outcomes are better, so they have a better response to the medication. And we chat probably every 7-10 days, every 2 weeks, just to keep an eye on what's going on and working with them and making sure that the changes that we made did indeed make an improvement, that there was a better response to their medicine. One, I also want to make sure that they understood what I shared with them, the difference on how to take their medicine. It's kind of a safety net, safety check.
So you're not just making a recommendation, you're making a recommendation and then following back up to make sure that your recommendation, one, is followed, but two, that it's actually having an impact as well.
Yes. And I think for me, it's the validation that we understood each other. Okay. It's also a validation for me that what I recommended is having the desired output. I don't want to wait for 3 months to see what's happening. Basically, what I try to do during this period is basically teach patients how to be a better patient. Pharmacists are trained to be pharmacists, and physicians are trained to be physicians. They just do not have a program to teach us how to be a patient.
Very interesting. Senior Pharmacy Solutions Medication Therapy Management Services helps seniors manage multiple medications. Lynn Harrelson, a senior care pharmacist, is my guest on the Aging with Options show. We'll be back with much more right after this break. You're listening to Aging with Options on 970 WGTK.